Good afternoon, everyone. We're very excited that you're going to be joining us today. My name is Dr. Natalie Barnett. I am the VP of Clinical Research at Nanit, and I'm going to be joined today by Dr. Rebeca Segraves. We are going to just give everyone a minute to join, and then we are going to be getting started with our webinar, and our webinar today is going to be all things pelvic floor, which we are very, very excited to talk about. So we will give our folks a minute or so to join. As many of you probably, joined our webinars before. You can use the chat to ask questions. We'll have time for questions at the end. So feel free to use the chat. Feel free to tell us where you're joining from and how old your babies are. We'd love to hear about your experiences and where you are and how far along in your postpartum journey you are. So Washington, D.C., amazing. Great. All right, I think we will go ahead and get started. So welcome to another Nanit webinar. My name is Dr. Natalie Barnett, and I'm joined by Dr. Rebeca Segraves today, and we're going to be talking about pelvic floor health and pelvic floor physical therapy. And I am very excited to introduce Rebeca. Dr. Segraves is a board-certified women's health physical therapist with over a decade of experience treating pelvic health and perinatal conditions in hospitals, homes, and outpatient clinics. And she has supported people through high-risk pregnancies, cesarean recovery, pelvic surgeries, and cancer-related care by working closely with OBGYN, surgical and oncology teams to make rehab part of the healing process from day one. So we're super excited to have Rebeca join us today. And so Rebeca, we are hearing a lot more about, pelvic floor and pelvic floor physical therapy these days, but I still think we need to talk about it more. And particularly, most of our audience are sort of, relatively new, postpartum women. And I think it's really important for, for us to understand what our pelvic floor is and what we can do to improve our pelvic floor and what pelvic, floor health looks like. So I'm wondering if you could tell us what is our pelvic floor and what is pelvic floor physical therapy?
Absolutely. And Natalie, thank you for having me. And thank you to Nanit for really hosting this webinar because I couldn't talk about this subject probably enough. I love talking about pelvic health and pelvic floor rehabilitation. And what I like to tell people about the pelvic floor is it truly is like the foundation of our body, right? We know that in terms of foundation, it's a group of muscles and tissues, ligaments, and tendons and the like that really support all of our organs. So that's our bowels, that's our bladder, our uterus, other organs of the body. And it really spreads throughout the base of the pelvic floor like a trampoline. And so during pregnancy and then, even after delivery, other pelvic surgeries, anything that disrupts the birth canal and the tissues around the birth canal, really we're looking at that disruption taking place around the trampoline, around the foundation of our body, which are those muscles and those structures. So that's essentially what the pelvic floor is a segment of muscles and ligaments and tendons and the like around the base of our pelvis.
Got it. And um, can you tell us why the pelvic floor is important?
Yeah, absolutely. I think honestly, OBGYNs have been researching this and have said it best. There was an article that was released in 2024, so pretty fairly recently, that likened pelvic floor muscles and the injury rates to ACL tears. And most people are familiar with sport-related injuries like the ACL,
Yep.
right? It destabilizes the knee. It needs treatment pretty early for those athletes to return to sport. Some people heal without surgery pretty well when rehab is started early. And so when I think of pelvic floor health, I read this article, and the thing that catches my attention, it is an amazing article about pelvic floor injury prevention. And the
Mhm.
thing that catches my attention is that they liken the pelvic floor to an ACL, and they advocate for early rehabilitation, especially related to any birth injuries that occur, just as we would rehabilitate someone who's torn their ligament. And
Mhm.
so I think about pelvic floor health and I think, well, this actually occurs to a higher degree than ACL tears. We have about 200,000 ACL tears in the United States that occurred a year that require surgery. And we have 570,000, way more than that, that occur for pelvic floor injuries. So I think really that the conversation around pelvic health and why it's so important is that we are seeing rehab start way later for those individuals with pelvic health concerns
Or
than
not at
we
all, right?
would. Absolutely.
Yeah. So I
Absolutely.
would
Or
love
not at
to know,
all.
what is the difference in the what proportion of those 500,000 folks who have pelvic floor injuries each year are actually treated for those injuries. Like, it's real, you wouldn't think twice about getting rehab for your after your ACL surgery, but people are not really, thinking about or focused on pelvic floor physical therapy. And I would love, and you mentioned something that piqued my interest, was you said something about um, preventing, any, pelvic floor injuries. Are there things that people can do who are pregnant who can prepare for birth or prepare for that, impending, injury, or try and prevent that pelvic floor injury that, that could be coming with birth?
Yeah, I mean, apparently there's really a lot of push, even from our OB providers. Our OBGYNs are really introducing to their clients early on screening assessments, just to ensure that, is this a person who may have had a prior injury before, whether it affected their hip or their back or even their knee, that would cause them to have issues with certain positions or issues with just baby getting through the birth canal. And a lot is being done on the preventative side while people are still pregnant to screen those individuals who may have more difficulty during labor. There's one in particular, recommendation, especially from this study, was screening people early who may benefit from pelvic floor therapy, but then also even during labor and delivery, when the baby's position is called the occiput posterior position or sunny side up. A lot of people have uh, been familiar with that position. Is that that position in particular during labor and delivery is more associated with pelvic floor injury. And so teaching people during pregnancy ways to move to really optimize baby's positioning is really valuable. And studies are being done slowly but surely. Studies are being done on a type of training that OB nurses are given across several hospitals. I actually attended one here in Colorado where I'm based called Spinning Babies. And so they're looking a lot at those positions that can be started as soon as the first trimester and getting people out of a position where, a lot of us are guilty of it, myself included. We sit where our tailbone is tucked during the day. Our knees are higher than our hips. And ideally during the day, especially for our working expectant parents, sitting with their hips higher than their knees is a big thing that they can do just with preparation, moving throughout the day, certain movements that really open the pelvis and kind of keep their hips and pelvic floor muscles flexible. There are so many preventative things that birthing parents are really being educated early on, and that's being driven by our OBGYN. So we're really grateful for that.
Amazing. Can you tell us what are the most common pelvic floor injury symptoms that you would see, during pregnancy and then postpartum? And so what are the things that folks should be looking out for as a sign that perhaps they should go and see a pelvic floor physical therapist?
Yeah, so there's three major ones that really stick out. Particularly, they are more of an issue early after birth, but they show up sometimes in some individuals during pregnancy. And we call those individuals our lucky individuals because, wow, this is happening actually before you deliver. So if you actually can spot this, you probably have more likelihood that you can really address it pretty early on. And those are pelvic pain. So that's any pain around the pelvic girdle. That's your front of the bone, pubic symphysis, back of the pelvis that connects to your spine, of your SI joints or sacroiliac joints. And really any low back pain that you may be experiencing that really could get in the way of certain positions during labor and delivery that may make it a little bit more challenging for baby to move through the birth canal. So pelvic pain, big symptom. If you're experiencing it during a pregnancy, we'd want to evaluate you and assess you and address that early on so that that pain isn't a limiting factor with your labor and delivery experience. The second two are too often common, even before people get pregnant. And so those include incontinence of any type. It could be stress related, where you already start noticing leaking with a big pressure, like a sneeze or coughing or laughing. And then also any pelvic pressure or heaviness that people feel. So that's the third one. It's not necessarily indicative of a condition that we call prolapse, but it could be something that we want to pay attention to and get you in positions where there's less pressure on the pelvic floor during pregnancy, which we know that's going to be a factor, but maybe we can find positions throughout the day that relieve that pressure.
Amazing. Okay. And so if we're thinking about um uh if we're thinking about um pregnant people, should someone go and see a physical therapist if they're having any of these symptoms whilst they're pregnant, or is it really only relevant for them after they've given birth? Like, are they think like is it it sounds like there's a lot of preventive things that they can do, whilst they are pregnant. So it sounds like, is it a good idea for everyone to be going to pelvic floor physical therapy when they're pregnant? It kind
That's
of,
my favorite question. It's my favorite question because, as I mentioned, really, I think in a talk I did earlier, I was saying if you actually have these symptoms during pregnancy, I almost consider you lucky because there's things that we can do about it before you're maybe saddled with more responsibility that takes your attention away from your self-care, especially if you're a first-time parent. But if you have, issues of leakage, urinary leakage, or pelvic pain or pressure in areas that just feel uncomfortable. And that's happening during pregnancy, absolutely. So what a physical therapist would do for the pelvic floor is very similar for what a physical therapist would do for any part of the body. Right? We really like to tag ourselves as movement system experts, but a lot of people don't realize that there's so much that impacts your movement system. There's your nervous system that involves your brain and the nerves that involve pain sensations or, sensations such as temperature or pressure. There's your cardiovascular system that really sees a lot of change during pregnancy and postpartum. So that's dealing with also the circulation to those muscles that are responsible for functions around intimacy, functions around bowel and bladder control. And so if you have any of those symptoms during pregnancy, absolutely see someone who can address and help you figure out how to use your body to really reduce a lot of those symptoms that are just uncomfortable. It may be even incontinence, not just of urine, but oftentimes we'll hear that people experience gas incontinence, and that is also a function of the pelvic floor that's really not closing properly around the sphincters, those muscles that should be closed when we want them closed and should open when we actually need them to function in that way. So absolutely, I will often coach people to see a pelvic health therapist. Really, when you kind of get out of the um, I would say the challenges of the first trimester,
okay.
whatever those look like for most people. But once you hit the second trimester, we usually see a bit of lift in energy,
Mhm.
but you're not necessarily in third trimester yet, where movement overall might be a little bit more challenging. It may be a little bit more difficult to start, tapping into your movement system that could help alleviate a lot of those areas of pressure that are causing your pelvic floor muscles to not function as well. So I would say early second trimester is the sweet spot for seeing a physical therapist.
That's amazing. I love that. And um, I heard someone use the analogy the other day that the pelvic floor is kind of like the basement of the body, and you really don't want to have a leaky basement. So you should be. I thought that was a nice analogy, um, but that
I
it's
love
to
that.
your
I
point that it's
love
very much the foundation, and we really need to understand how foundational the pelvic floor really is. So we're talking about, pregnancy and postpartum, but is it too late for people to be fixing pelvic floor issues that they may have had for years and years if they're 5 years or 10 years or 20 years postpartum?
I often say I'm probably pro the human body all the way. You know, people talk about being bullish on something. I'm bullish on the human body. I think I've had more cases, more often than not, where I've seen people 20 or 30 years postpartum. We consider postpartum the duration of your life because those changes in your body don't necessarily all revert back to your pre-pregnancy state. You know, some of those changes really are lifelong, in a good way as well.
Yeah.
And so, what I consider postpartum and attributing a lot of the people that will come to me 20 or 30 years down the road, having its source around the time of their birth, we're still asking about their birth and they'll remember it like it's yesterday. People's
Oh, yeah.
memories are absolutely sharp on the day they delivered for every child, right? If there's multiple children. And so the human body has not failed to amaze me. I really don't think that there's any such thing as too late. And I give my own personal story. I, tore my ACL and I'm still rehabbing it to this day. I mean, that's a more than 20-year-old injury. But I've had patients who are 30 years postpartum, post-cesarean delivery, and we're still trying to understand, wow, there's so much regeneration of muscle tissue compared to other tissues in the body. There's really so many advances that have been made in understanding that muscle tissue really has its own special physiology where it can really support the body at later ages in life. There's really no such thing as too late when you start to train the muscles in a way. And so the pelvic floor muscles are really not to be trained unlike anything else. They are to be trained like the rest of our muscles because they really respond well to training for individuals even down the road. So there's never a late time.
That's amazing. Okay,
Yeah.
great. Now I have a strange question. Can you walk us through a pelvic floor exercise that you think everyone may be able to benefit from?
I absolutely can. We call this an exercise, but it really is, I think, the foundation of life. You know, we talked about the pelvic floor being the foundation of the body. Well, this exercise is called 360 breathing. The
Mhm.
way I like to actually think of it is if people actually join me and put their hands around their rib cage, I think what we can appreciate when we put our hands around our rib cage is that it really is, it encircles our spine.
Mhm.
And in a 360 way, what we're trying to do with a 360 breath is really just feel on all sides of our body that the rib cage can expand. And so, with just a simple inhale and a simple exhale, you should be able to appreciate that the rib cage moves out
Yep.
rather than necessarily up and down.
Yep.
The rib cage itself. But the exercise involves two major muscles, lots of muscles in between, but two major muscles that we really focus our attention on is the diaphragm that really sits as the base of that rib cage or the foundation of that rib cage, and your pelvic floor that sits on the foundation of your pelvis.
Okay.
And what we've known is that when we inhale, the diaphragm makes room for our lungs by moving down, and the pelvic floor follows that pattern. As we exhale, the diaphragm returns to its dome shape
Hmm.
inside of our rib cage. So the exercise is called 360 breath. And when we teach it, we teach people to really focus on their breathing. If they're holding their breath, if they're gritting their teeth, to just relax everything, sit up in a tall posture, put their hands around their rib cage, and inhale, appreciate the movement of the diaphragm going down, your rib cage expanding, and your pelvic floor relaxing. You're not tensing or contracting your pelvic floor anytime at all. And then when you exhale, your pelvic floor should just return to its resting state and diaphragm follows. So it's just a slight lift of your pelvic floor. So inhale, ribs go out, pelvic floor moves down, diaphragm moves down, and then exhale, everything returns to its resting state. And in that exercise, Natalie, what we're trying to get people to appreciate is really check in with your breath because oftentimes when we're holding our breath or gritting our teeth or we're really focused on a task, oftentimes those muscles really do communicate with muscles all about around our body. And the pelvic floor in particular stays in that contracted state along with other muscles of our body. And when we bring people to an awareness of their breathing, that's a really simple exercise that everyone can benefit from because it really causes them to focus on relaxing those muscles, which should be relaxed during most functions, like delivering a baby, um, you know, uh, doing tasks for bowel health, bladder health, all of those states where the muscles really do have to function in both states.
Amazing. Okay. So can you tell us, I know we talked about those, those few things, uh, a few things that people, may be experiencing with with pelvic floor issues, but can you tell us sort of exactly what parents, what signs there are that someone should be going to see a pelvic floor physical therapist? I just want people to
Absolutely.
understand that, this is something that we should be talking about. And I just want to raise awareness around this issue so that, people are not 10 years postpartum and still, having urinary incontinence when it could have been fixed, 6 months postpartum. So I would love you to sort of just really kind of nitty gritty tell us sort of exactly what the symptoms are that are an indication that someone should be reaching out to a pelvic floor physical therapist.
Absolutely, Natalie. I'll be glad to. And let me actually answer this in a broad way, starting with that study that was released by the American Journal of Obstetrics and Gynecologists. Now, this is the seminal journal from ACOG, right? That was released in 2024, and it's the same one I referenced before. And what they noticed were kind of those three main symptoms that I talked about that we would
Yep.
be lucky to catch during pregnancy are also prevalent really early after birth. And those are pelvic pain of any sort,
Yep.
incontinence, particularly stress urinary incontinence. And so that's bladder leakage with just even movement transitions, getting in and out of a car, which a lot of parents are doing in the first week to get baby to their appointment. And then also any coughing, laughing, and sneezing that causes that bladder leakage. And the third is any pelvic heaviness. And most moms could sense when something just doesn't feel right, almost as if there feels like a tampon inside of the birth canal, but they know that there's no tampon or anything in the birth canal for 6 weeks after birth. So that doesn't feel right as well. And so what this study did was it focused on those three symptoms. And they said a priority for these individuals is to treat them as if they had an ACL tear.
Mhm.
And because of this is really important for people to know. The pelvic floor muscles that we're really talking about, especially with the exercise for 360 breathing in the diaphragm, they're actually known as a group called the levator ani muscles. And in that study, the levator ani muscle injury that happens primarily with vaginal delivery, but it can if that person was pushing and then had to have a cesarean delivery, those injuries actually occur more than 6 times that of perennial tears. And a lot of people will know and they'll hear, did I tear during birth? And a lot of those tears that they're told about are perennial tears or anal sphincter tears, which are a little bit more than perennial tears. And this is important because a lot of the injuries that precipitate or cause stress urinary incontinence, pelvic pain, and that heaviness, that tampon feeling in the birth canal are actually related to the levator ani muscle tears that happen in 19% of births.
Hmm.
The anal sphincter or the perineal tears actually have less than a 3% incident rate. So 19% versus 3%, which we often will say those people need pelvic floor therapy. Those that have the 3% perineal tear rate
Yeah.
versus the levator ani muscle. And the reason is because you cannot actually see it on exam,
Uh,
especially if your OBGYN is waiting 6 or more weeks to
yeah.
examine you.
Yeah.
And so if you have symptoms of pelvic floor heaviness,
Yep.
stress urinary incontinence, or pelvic pain, that's an indication by those OBGYN researchers is that you should start rehab within the first 2 weeks after delivery, up to 6 weeks. But they really, really recommend early rehab because what they've noticed is that people who wait longer result in more short and long-term complications. So that's a really important
Sorry,
question.
can I just clarify that, Rebecca? Are
Please,
you saying
absolutely.
you should start physical therapy within 2 weeks of
That is
birth
correct.
or
Within 2 to 6
after
weeks.
2 weeks? Okay.
Mhm.
Okay. So is there a time that's too early to start?
No, with virtual care now, I will say that we've seen probably people within the first week. And I should
Right.
actually give a little bit of my background.
Yeah.
And so I started several programs that now are expanding throughout the United States, but they follow very closely to a European or French model of care, where we're seeing more parents in the hospital at the time of birth. And so if they do have an injury or they had a cesarean delivery, physical therapy around the country is being offered during their postpartum admission before they go home. And so the question is there ever too early a time to start? Well, I would say if you had a surgical birth specifically, that would include not just a cesarean delivery, but if you actually had sutures where you tore and there was some type of intervention done, surgery involving that repair, then I would say that you're falling into that group where we would like to see you within the first 2 weeks because there's a lot of tissue healing principles that apply, especially with someone so active as the birthing parent. You're
Yep.
lifting a baby, you're getting up several times throughout the night. Most people after a surgery, especially after a cesarean delivery, are not as active as a birthing individual. Birthing individuals, their own special population of folks that really would benefit from earlier care. So if you have the luxury of being in one of those hospitals, we have about 96 hospitals in the United States at the time of this talk that offer rehab in the hospital after birth. But then
That's
more and more
amazing.
practices like
Yeah.
Origin are offering virtual care within the first week of delivery.
That's amazing. Rebecca,
Yeah.
can you just kind of walk us through what someone could expect during their first pelvic floor physical therapy session? Because I would love you to kind of, I've never done, I am a huge physical therapy fan. I've never done pelvic floor physical therapy. I probably should have, I probably should. And after this, I may do. But I'm wondering if you could just tell us what the first visit would typically look like. And then also too, because I know that Origin has a combination of sort of inpatient, clinic and telehealth visits. Can you tell us what a virtual visit might look like as well? So those two things.
Absolutely, Natalie. Let me clarify because most people would probably want to know what a pregnancy visit would look like and an
Yep.
early postpartum visit.
Okay.
Let me
Great.
walk you through both. Okay. So
Great.
with a
Thank you.
pregnancy visit at any stage of pregnancy, most often we are going to, at some point during the evaluation or your first visit, look at how you're moving. Because a lot of times we can sit and talk and get your history of any back pain or hip pain or injury during your youth that may give us clues, but it's nothing like that eval to actually have you demonstrate either virtually or in person how certain movements feel, whether it's that squatting or lunging in a certain type of way or doing a stretch that we know positionally will make it a lot easier for baby to get through the birth canal.
Yep.
The other thing, a lot of times our evaluation has to cover your actual pelvic health. So, is there any pain or any history of pelvic pain, of leaking, of bowel dysfunction, of anything that could actually give us clues as to how your pelvic floor is functioning?
Yep.
And so that evaluation is data collection at its finest. It's getting more of an inventory of your body, of your history, and it's actually connecting you with a lot of your history because a lot of people will somehow recall more about their history of either painful menstrual cycles or issues where they may have held their bladder for a long time if they're in professions such as teaching or, healthcare. That really can impact how their pelvic floor is doing during pregnancy and what it may look like after delivery. And so a lot of it is just information recall of your own body and then taking into account a lot of movements that can really help your body prepare for the big day. And most of us will not show up to a marathon without having trained. So a lot of our visits really are circling around that individual, a plan that they can use along with their normal exercise routine or whatever it is, a plan to help them prepare for labor and delivery. That's what the first eval looks like, right, during pregnancy. And the beauty of this eval is what I've found is that you can do a lot of it virtually. Just as
Right.
I'm talking with you now, a lot of us are using, our spaces to demonstrate movements that we want people to do. And then we're watching and focused,
Mhm.
and able to give a lot of coaching and cues on how those movements would actually work with their body and their unique circumstances. So that's what pregnancy would look like, the
Yep.
first day with a therapist. Now, postpartum, we're talking about early recovery. So say if you have an individual who did, experience maybe a challenging birth, whatever that was, a challenging birth experience. And I was able to see them within the first 2 weeks, whatever that looked like. A lot of my eval, even in person or virtually, is going to cover what that day was like for them. So it's a lot of information recall again of their actual labor and delivery. If it's my first time meeting you, Natalie, I might even ask more questions about pregnancy. How did that go? Were you feeling pain? Did you have any leakage during pregnancy or even before you became pregnant? Did you have any heaviness? And I'll start to ask specific questions around those three main symptoms that we've been talking about, just to ascertain, was there an injury to the levator ani, which we know is not visible on a vaginal exam. It's often visible with imaging, which a lot of people after birth are not given. And so that first visit is information collection of just their symptoms, and then we go right into positioning. A lot of times we're in what position after birth? We're holding baby.
Yep.
And so we know that those forward flex positions really do put a lot of pressure through the pelvic floor, the foundation of our body. And so a lot of times we are doing a lot of positioning interventions and a lot of breathing interventions that help those muscles find balance because this is not as balanced as positions that really help to improve extension of the spine as well.
Amazing. Okay. And so it sounds so from what I'm hearing, a lot of this can be done virtually, which gets us to Origin. So can you tell us a little bit about Origin and why pelvic floor physical therapy really lends itself to a telehealth model?
Sure. And so a lot of what we talked about, pregnancy and postpartum, is information collection. And so in my first visit, especially if it's virtual, I'm collecting information that really helps me determine should this person be screened early on, especially within the first 6 weeks, in person by a therapist, which we know there are um, a very, very low number of pelvic health therapists. I knew the number at one point, but it's escaping me now. But around the country, we have such a lack of pelvic health therapists that clinic wait times for most clinics around the United States are well over 30 days, if not much longer than that.
I heard 2 to 3 months the other day.
2 to 3 months for some people, and then the most I've ever heard was 6 month wait.
Oh,
And so for a 6 month wait, if we're trying to get someone in within the first 2 to 6 weeks, that's not possible. So what virtual therapy has done is really fill in those gaps, just like we're seeing in the hospital. We're having therapists who are trained to treat patients, especially moms, first time after a major cesarean delivery or maybe a traumatic birth experience. We're training these therapists to fill the gaps. And what virtual care is doing is it's taking a specialist like me and putting them face to face with someone via telehealth to do the information gathering and to really start a lot of those positioning interventions pretty early on, or to spot someone who may be doing a bit too much activity that could actually put too much pressure on their pelvic floor. Because what we know about the levator ani muscle injury, we know that it occurs more than 6 times that of a peroneal tear, which people can see and feel, right? So the levator ani muscle injury that occurs to that extent, and they cannot see it, we want to especially address those individuals, talk about early compression that they could possibly give to their pelvic floor, talk about ways to move and breathe with movement, talk about baby positioning and carrying techniques. There's a lot that we could do virtually and then fill in that space up until they actually are able to see someone at 6 weeks postpartum or whatever that is. And so it really provides early intervention to that individual who may not be close to a clinic, and it may not be convenient to go
Yeah.
back and forth to a clinic as you're caring for a newborn.
Yes. Um, so to that point, Rebecca, how would you know whether you need to go in person or whether a virtual visit is fine?
A lot of times it's really how the person is describing not only their birth experience, but any symptoms. Their symptoms are the biggest clues that we have because we know that even if they were to see their OBGYN at 2 weeks, and some individuals are seeing their OBGYN that early on, we know that these particular muscle injuries cannot be detected on exam. And it's very unlikely that you may have ultrasound or an MRI just to detect if there's an injury. So a lot of times that first visit with someone early after birth gives me so many clues as to whether or not we may be able to treat this conservatively with rest, with compression, kind of the same protocol we might use for an ACL tear, is truly a muscle tear in any part of the body. And we may be able to treat this conservatively, but there may be specific things I'll ask you to do or not do, and really gather your own personal team around you, your family, your friends, anyone to support you, so that maybe the time that you're on your feet is a little bit less as your pelvic floor is healing. And so a lot of times we can really, if we intervene early enough, that person's clues and then how they respond to those interventions within 2 to 3 visits can give me a lot of information. And in that 2 to 3 visits, you have to kind of think about this. Most people, if they're lucky at all, are seeing a therapist after 6 weeks. And
Yeah.
so if I can see you 2 to 3 times, you're waiting that long anyway, and we've already started your early intervention. We've already started your rehab. And so a lot of times I'm looking for clues as to how your labor and delivery went,
Mhm.
what your symptoms are now, and then how you respond to interventions to determine, I really think one of my colleagues should see you, and then perhaps really see how your muscles are functioning. Because even though we cannot see a tear, especially if it's a deeper tear, not the perennial tear, but the deeper levator ani muscle tear, we can assess how your pelvic floor muscles are actually functioning just from an external exam. And that tells me, yes, that was a really good call on my part to refer you to an in-person therapist.
Wow, that's amazing. What just special, amazing work. You must feel very happy to be able to do this work every day. Incredibly rewarding. Now, we've got a couple of questions here that I would love to get to, and this is a good one, and we didn't really touch on it, but I would love you to answer it. Is pelvic floor therapy needed if I'm going to have a C-section?
Oh, yes. So that's my passion area.
Okay.
And yeah, so yes, absolutely. So a lot of my work started in early recovery after surgery. So I could talk about surgery all day long.
Yep.
But a lot of the work that we did in the hospitals early in 2020, and it really picked up at the end of 2020 up till now, have been with parents after C-section. And so you remember how I said we're super lucky if we know those moms who have symptoms during pregnancy so we can address them early. Well, if someone actually knows that they're going to have a cesarean delivery or they had a cesarean delivery, we are over the moon excited to see that person early on. And there's a lot of reasons why. And so we know from a surgical standpoint, the abdominal cavity has 7 layers that really are dissected or cut to get baby out during a cesarean delivery. And so if you think about what that pelvic floor muscle exercise that I gave just through breathing, Well, everything around in the middle between the diaphragm and the pelvic floor, that is impacted with a cesarean delivery. And so, what we like to really talk to people about is think about your abdominal cavity like a soda can that's closed with the diaphragm and the pelvic floor at the bottom.
Yep.
Then you take a cesarean delivery and you poke a hole through that soda can, right? And so all that pressure really is able to collapse or crush the can. And
Mhm.
so what we want to do early with cesarean delivery is teach the core how to stabilize around the spine again. And so we've started 24 to 48 hours with moms specifically after cesarean delivery in terms of rehabbing their core. So there's never too
Wow.
early of a time.
Yep.
And so 96 of our hospitals primarily are offering rehab after cesarean delivery, but then adding in the pelvic floor muscle diagnosis, which are so many, right? We don't have enough therapists in the country that really can see this population. But cesarean delivery specifically is the most common major surgery in the world, not just the United States,
Yeah.
in the
Oh, well.
world. And
Wow.
so what we're trying to do is get moms in as early as possible to a rehab therapist because their activity level is so much higher than your abdominal surgery population that we normally treat in the hospital as therapists after hernia repair, which involve little tiny incisions. But after a C-section, a lot of moms are sent home without a dedicated recovery plan. So
Yeah.
if anyone knows they're having a cesarean delivery or they're still recovering pretty early, see a therapist that's trained and pelvic floor function as well, because they're going to look at you as a canister that you are.
Yes. Okay. And this sort of leads on to a great question. How can someone find a qualified pelvic floor therapist near them? And someone else asked, how can I find one that's covered by my insurance?
That's a really great question. Some directories out there, there's so many different ones, but a lot of times, and I hope this is not too controversial to bring AI into this. I have had people find not just me, but just practices using ChatGPT and other AI over Google. I
Wow.
mean, there's the search engine capabilities that really AI is finding are just outstanding. And I think there's going to come a time, Natalie, if I may be so bold, to say that we'll be able to actually tell these engines to search for a therapist that accepts my insurance. Because right now, what we're seeing a lot of directories exist. Even with Origin, we have our own directory list of around the United States that provide virtual care. But then do they accept my insurance? That's still something that, causes you to have to, go down the avenue of calling the clinic, verifying your insurance, and taking those steps. So I think we're not there yet, but a lot of times you can find the directories that exist,
Yeah.
even using one single search engine through ChatGPT. I mean, it's really phenomenal what these engines are able to do.
And does Origin provides virtual care in all states in the US?
In all 50 states. And
Okay.
so there's specifically what we're finding is that first consultation really helps us determine could this person benefit from a physical therapy evaluation. So in all 50 states, we're providing pelvic health coaching, which
Mhm.
is really taking someone and
Wow.
going through that inventory list,
Yeah.
actually going through their own history, what they're experiencing, and just seeing could potentially a program really help them recover to their fullest extent, or could they benefit from an evaluation by a
Mhm.
pelvic health therapist? So that's the care that we're providing in all 50 states, and it's
Wow.
phenomenal. It's been a phenomenal experience.
Oh, that's really amazing. Now there's another question here that I wanted to get to. Is it normal to have painful sex a couple of years postpartum?
I don't think pain is normal at all. I think that pain 100% of the time is the body's way of protecting itself. That's really what we understand about pain and the science behind pain. And so, painful sex, especially with intimacy, with someone that you trust and that you love and that you feel safe with, but then also you're still experiencing pain during a very intimate activity, I wouldn't call that that's normal at all. I would say that if you haven't actually had someone really go down that inventory list, that data information gathering and eval of your history, of your particular circumstances. If you haven't had that yet, that would be a person who is an absolute 100% candidate for having a pelvic floor therapy evaluation. That's a
Right.
very good question.
Great. Thank you. Um, Now we have another question here. If someone feels discouraged about their recovery, what's your biggest piece of advice?
I love that question. Wow. I would say, um, really I would honestly, what hits me the most is I'm in that state now with a particular client. And I'm just so thankful, really, for just the honesty and the transparency around the information that they were even given, or things that they tried and not just haven't been working. And the first thing is really just to acknowledge it, acknowledge your frustration, acknowledge what happened around the time that your function completely changed. That things just kind of got off the track, and just acknowledge and sit with it. Feel validated really with where you are and where you want to be, and what that gap looks like for you. And that's not to sound cliche at all, but I think a lot of times, just really taking inventory of all of the events, maybe going back to areas around the source of that injury, which may be uncomfortable for some. I think it really is absolutely important in the healing process. And a lot of times, just having a provider that gets to know who you are and what your goals are, I think that that can't be underestimated. I think that that is absolutely important. So just first of all, the first step is really just acknowledging where you are, and
Mhm.
then what do you want to do about it? What do you want to change? Because if you are doing the same thing over and over again and it's not yielding the results that you want, it's time for a change. But determining what that change is, you may need to talk to someone completely new who takes inventory of you first.
Yeah. And do you think all women, or well, all people should have a pelvic floor evaluation?
Just in general, I would say honestly, when our pelvic floor is functioning, we are happy, as really a species. I mean, when we notice when something is off, right? And so I would say, if it's not broken, there's no, reason to call the plumber or call the electrician or call kind of
Yeah.
all these specialists in our space. Just for general education, I think there's so many resources really out on the web and at our disposal to just learn about our pelvic health and how to keep it healthy. But truly, generally, if there's no issues, I wouldn't necessarily say you have to go see a pelvic floor specialist. But if you are having changes that affect your bowel health, your bladder health, your reproductive or your intimate health, that is absolutely, those are kind of those key indicators that really signal you may want to talk to someone who specializes in this area to get more of a sense of your body and the changes that you're experiencing and what you can do about it early. Because continuing on with those impairments is what we call them, or that dysfunction, that would not be normal. In fact, it's ill-advised because generally those symptoms do get worse over time if they're unaddressed.
Yeah.
Yeah,
Yeah, and I do think as women, we often can just sort of ignore symptoms or just think this is just part and parcel of having a baby or even just being a woman, and years and years can go by and without, realizing that this is, perhaps not normal. So I think it's really great that people like you are really, talking about pelvic floor health and how to access pelvic floor physical therapy, because I just think it's so incredibly important
I
for
agree.
to
I
know.
agree. And that would really couple, I think, a lot of what you're saying is could anyone benefit? And I think yes,
Yeah.
especially if the main message that we've heard is that this is normal or an expected, expectation of delivery. I think too much of that message is probably being broadcasted and not
Yeah.
enough of even the study of seeing someone within 2 to 6 weeks. I was shocked when I read that and I said, oh man, once this hits the airwaves, we're really going to see a lot more people informed about their care earlier
Yeah.
on. This
Yeah.
is this is absolutely normal to address your recovery just as you would the health of your baby and your family.
Yep. Exactly. Exactly. And I think it's very easy for women to sort of put ourselves last and to really be the, you know, the nurturer and just be always giving to other people. And it's really important to be, making sure you're looking after yourself as well. So Rebecca, just so grateful to you for talking to us today, and just wondered if there's any sort of last comments you wanted to make, or last, takeaway pieces of advice you wanted to give our folks.
Well, absolutely. And I think that now that people kind of have more of the awareness that, hey, if I'm experiencing this early on, well, what do I do about it? And a lot of people will say, well, my OBGYN didn't give me a referral. And so I think the biggest takeaway, if you take away, nothing from this talk, is just to know state by state, you have the autonomy as an individual to say, I want a second opinion, or to really interview and choose the best provider that maybe has a bigger team around them. And oftentimes, I don't know that we do that well enough, is that when we're choosing an OB provider or a birth provider, we're not really asking about their team. And we
Yeah,
would never have a major surgery, whether that's a knee replacement, a hip replacement, an ACL repair, without making sure that the surgeon has a rehab team that's going to
yeah,
help us recover.
yes,
Because there's more than just that surgery
yeah.
that we're going to need to get back to our function. We're going to need a recovery plan. So just make sure that your OBGYN, your birth provider, they have a recovery team
Mhm.
as they're doing these major procedures like a cesarean section every day. We know we're seeing 1.2 million C-sections in the United States a day, and we're seeing 500,000 women require
1.2 million a day?
1.2 million a year, 1.2 million a year
Right.
C-sections, and then also 570,000 women needing some type of intervention for a levator ani injury.
Yeah.
So
Wow. It's a lot.
interview your birth provider and just make sure they have a recovery team on board, and then ask them specifically, when do you recommend I start therapy, just to have a consult with your provider, because oftentimes you're going to see us a lot longer
Yeah.
than your OBGYN, who may give you that one visit at 6 weeks and that's it. So just interview your birth team.
Yes. No, that's great. And someone is saying in
That
here,
is absolutely right. In a lot of states,
you
you
don't need
do
to have a
not need a
prescription.
prescription from your
Yeah.
provider
Yeah.
to start therapy. So that's a beautiful, beautiful statistic there. Is that if you feel that there's something wrong, don't wait for your doctor to catch it, because oftentimes they would need more imaging and more resources to really catch if there is an injury. You want someone who can advocate for you a lot earlier than that.
Yeah. No, amazing. Well, Rebecca, again, thank you so, so much for joining us and sort of sharing your wisdom and, giving us your time today. We really, really appreciate it. I certainly learned a lot, and I'm sure everyone else did as well. And if there's anything, and if I think everyone knows about the Origin website, but there's a lot of information there if people wanted to go there for more info. It's a really, really great resource. So again, thank you so, so much. And we look for hopefully we can do this again another time soon.
Absolutely. Thank you so much for having me.
Amazing. Thanks, Rebecca. Thanks, everyone. Bye.